Hello and welcome to the channel. I thought we'd do something a little different today. I'm recording this video at the hospital parking lot. I am going to go get one of my injections, my anti-cancer injections. They're administered by nuclear medicine, and rather than injections, they're called infusions. The only difference that I can see is that instead of getting an injection in your muscle, you get a needle in your arm as if you were getting a transfusion. And you just sit there and they pump the medication into your vein. You're there for as long as it takes for them to administer the infusion, the injection. And then there's a lady that walks around with a Geiger counter, I guess probably to make sure that you haven't exceeded the accepted radiation levels. I don't know. I do know that I joke about it, but I guess it's more serious than I let it out to be. I call myself radioactive. I say, well, don't get close to me because I'm radioactive. Actually, I guess I am radioactive because they tell me not to get close to people for about 24 to 36 hours, 2 to 3 days. And so here I am, ready to drive myself back and forth. Sometimes, this hospital is about an hour from the small town where I live. And remember that I mentioned that I have a leg bag strapped to my back, to my leg, I mean. Well, that leg bag, that is a Foley catheter that drains the urine out of my bladder because my prostate is so big that it doesn't let the urine come out naturally. And the place where I have to go, every month I have to have my catheter changed. And the place where I have to go every month is also in town, in the bigger, the metropolitan area where the hospital is. So if I don't schedule my trips to town carefully, I find myself going and coming to town a lot. And it takes me about an hour. It's an hour round trip. So here I am now waiting for, what happened was I was able to schedule my catheter change and my infusion more or less close together, but I'm still finding myself having to schedule my lunch between the two appointments so I don't waste a lot of time just waiting around for the infusion. And here I am, waiting for time to in about 10 or 15 minutes I should be going in there, unless I just want to go there sooner and get sooner and wait for the time to of my appointment a little sooner than that. Anyway, I see that someone's parking right next to me, and there's probably going to be a lot of noise coming up, so I'm going to cut this video short. Let me know if you have any questions, and please remember to subscribe if this video is of any help to you, and let me know if you have any questions, like I said.